Question number 1. Systemic lupus erythematosus is A. Infection, B. Degenerative, C. Autoimmune disorder, D. Allergic disorder. And the answer is number 2. Which of the following best describes a Z-track injection? A. A method of injecting medication into a large muscle. B. A method of injection that allows a relatively quick uptake of drug but with a prolonged mode of action. C. A method used to prevent injuring sciatic nerve. D. A method used to avoid accidentally giving the drug intravenously. And the answer is number 3. Family planning service fall under dot health service. A. Preventive, B. Promotive, C. Curative, D. Rehabilitative. And the answer is number 4. Chronic malnutrition is characterized by A. Weight for age, B. Height for age, C. Height for weight, D. Weight for height. And the answer is question number 5. Before administering of drug, which of the following factor will you consider the most? A. Weight, B. Height, C. Mid upper arm circumference, D. Age. And the answer is number 6. Fracture of which part of spinal cord may cause tetraplegia? A. Cervical, B. Thoracic, C. Lumbar, D. Sacral. And the answer is question number 7. Road to Health chart is used to identify A. Mental status, B. Nutritional status, C. Circulatory status, D. Acid base status. And the answer is number 8. First priority of patient with a spinal cord injury is A. Prevention of extension and flexion of spinal cord, B. Maintenance of airway, C. Maintenance of circulation, D. Prevention of dementia. And the answer is Number 9. Nursing theory which focuses on nurses helping client to gain independence as much as possible was proposed by A. Jean Warson, B. Hildegard Paplew, C. Virginia Henderson, D. Florence Nightingale. And the answer is question number 10. Which of the following antihypertensive drugs should not be used in a patient on lithium in order to prevent lithium toxicity? A. Clonidine, B. Beta blockers, C. Calcium channel blockers, D. Diuretics. And the answer is question number 11. Most important factor of hand washing is A. Soap, B. Water, C. Friction, D. Steps. And the answer is question number 12. Baby with triples at the end of A. 1 month, B. 6 months, C. 1 year, D. 2 years. And the answer is question number 13. A patient is found to have tonic-clonic seizure. What precaution do you take for patient? A. Prevent from infection. B. Prevent from aspiration. C. Prevent from injury. D. Prevent from outlookers. And the answer is number 14. Which of the following development tasks should an older adult achieve? A. Adjust to environment. B. Accept date of spouse. C. Home based care. D. Maintain intimacy. And the answer is number 15. According to National Immunization Schedule, pneumococcal conjugated vaccine is given at A. 6, 10 and 14 weeks, B. 6, 10 and 12 weeks, C. 6, 10 and 9 months, D. 6, 14 and 9 months. And the answer is question number 16. PCR in HIV detect A. Antibody, B. Antigen, C. Virus, D. Antigen and antibody. And the answer is Question number 17. Which type of hallucination is common in patients with schizophrenia? A. Tactile, B. Gustatory, C. Auditory, D. Olfactory. And the answer is question number 18. A man perceives a wall painting as an animal. This is an example of A. Delusion, B. Illusion, C. Hallucination, D. Perception of reference. And the answer is question number 19. Excessive vomiting in child causes A. Alkalosis, B. Acidosis, C. Hyperkalemia, D. Hypercalcemia. And the answer is number 20. An infant after a surgery of cleft lip should be fed using A. Cup, B. Syringe, C. Spoon, D. Rubber tip syringe. And the answer is question number 21. Universal recipient of blood group is A positive, B positive, C O positive, D AB positive. And the answer is number 22. A child develops jaundice after 48 hours and peak in 5 days, that is A. Biliary atresia, B. Septicemia, C. Pathological jaundice, D. Physiological jaundice. And the answer is question number 23. After ejaculation, sperm can survive inside the female body for A. 2 days, B. 3 days, C. 4 days, D. 5 days. And the answer is number 24. Toilet training should be started at the age of A. 6 months, B. 12 months, C. 18 months, D. 24 months. And the answer is question number 25. Life-threatening complication of mumps is A. Infection, B. Deafness, C. Encephalitis, D. Orchitis. And the answer is Question number 26. Complex spot present in buccal mucosa is characteristic of A. Mumps, B. Rubella, C. Malaria, D. Measles. And the answer is number 27. A mother with diabetes mellitus gives birth to a baby. As a nurse, you know at the birth the newborn is at risk for A. Hypoglycemia, B. Hyperglycemia, C. Jaundice, D. Hyperthermia. And the answer is number 28. A patient is in post-operative ward after the surgery of tonsillectomy, which finding may suspect the nurse that hemorrhage may have occurred. A. Frequent swelling, B. Frequent changing of position, C. Sleepiness, D. Hypertension. And the answer is number 29. Care after cardiac catheterization. A. Check distal pulse, B. Check blood pressure, C. Check consciousness, D. Check for sleepiness. And the answer is question number 30. A child born with Down syndrome usually have A. Hydrocephalus, B. Diabetes, C. Ventricular septal defect, D. Clawfoot. And the answer is question number 31. What should the nurse do when planning nursing care for a client with a different cultural background? A. Talk with the family, B. Talk with others for experience, C. Explore or read about their culture, D. Identify how these cultural variables affect the health problems. And the answer is question number 32. Well resuscitation of a newborn baby with bag and the max, assisted ventilation rate should be dot breath per minute. A. 20 to 30 per minute, B. 40 to 60 per minute, C. 60 to 80 per minute, D. 80 to 120 per minute. And the answer is question number 33. A pregnant woman at third trimester at the antenatal clinic and complained difficulty in breathing. The nurse explained the condition is due to A. Upward displacement of diaphragm, B. Eating too much food, C. Weight gain, D. Big fetus. And the answer is Question number 34. As an OT nurse, how will you provide information about the patient to the post-operative nurse after surgery? A. Verbal, B. Written, C. Sign language, D. Email. And the answer is question number 35. Symptom of baby with tracheoesophageal fistula. A. White color bubbles in mouth and nose. B. Talking while feeding. C. Cyanosis. D. All of the above. And the answer is number 36. Which of the following is a definitive method for diagnosing Hirschsprung disease in order to plan for surgical treatment? A. Barium meal X-ray. B. Full thickness biopsy of rectum. C. Rectal manometry. D. Rectal suction biopsy. And the answer is question number 37. First intervention during the attack of bronchial asthma. A. Oxygen. B. Intravenous fluids. C. Corticosteroids. D. Antibiotics. And the answer is question number 38. When does the first temporary teeth erupt? A. 4 months. B. 8 months. C. 12 months. D. 16 months. And the answer is number 39. Dentine is covered by hardest substance, which is called A. Enamel, B. Cement, C. Calcium, D. Caramel. And the answer is question number 40. A patient having myeloid leukemia is going for chemotherapy. The priority nursing intervention is A. Administration all pre-chemotherapy drugs. B. Prevent infection. C. Management. D. Maintain privacy. And the answer is number 41. What is the priority action when caring for a patient with disseminated intravascular coagulation? A. Monitor for Bowman signs. B. Avoid intramuscular injection. C. Take temperature via rectal routes. D. Apply sequential compression stockings. And the answer is Question number 42. Appearance of rainbow color circles around bright lights is usually present in a patient with A. Cataract, B. Glaucoma, C. Retinitis, D. Retinal detachment. And the answer is question number 44. Accidentally chlorine get into the eyes. What should you do? A. Floss eye with clean water. B. Put eye antibiotic. C. Close the eyes. D. Apply aloe vera to the eyes. And the answer is number 45. Cold application for short period of time is done to maintain A. Increase circulation, B. Change in temperature, C. Muscle stiffness, D. Local anesthesia. And the answer is question number 46. Structure tool to observe and describe a patient's psychological functioning is A. Psychological test, B. Mental status examination, C. Glasgow Coma scale, D. Pain scale. And the answer is number 47. Which of the following is the function of frontal lobe? A. Voluntary movement, B. Encoding memory, C. Auditory information processing, D. Sensory function. And the answer is question number 48. Vestibulocochlear nerve is eighth nerve with sensory function and is also A. True nerve, B. Cross nerve, C. Complex nerve, D. Pair nerve. And the answer is question number 49. Gland of stomach secrete gastric juice which contains A. Hydrochloric acid and pepsin, B. Lipase, C. Amylase, D. Trypsin. And the answer is question number 50. Histamine is secreted by which of the following cells? A. Plasma cells, B. Kupffer cells, C. Monocyte, D. Mast cells. And the answer is